wart is a viral infection, and it's a viral infection that gets into your skin, usually through little cracks in your skin. And the way you get the cracks in your skin is usually patients will have sweaty feet, which the hyperhidrosis allows for little cracks in the skin, or the patients can easily pick this up when they're at pools or public gyms when they've been swimming and their feet or fingers get all pruny and they walk into the standing water, and the little cracks in their skin allow the virus access to get in and begin to cause an infection. But unlike a cold or flu virus, where the virus is floating around your bloodstream and your body is able to mount an immune response, the wart virus just grows in the top layer of your epidermis, which is really 30 layers of dead cells. And as it grows and grows, your body really doesn't react too much that it's there or mounts an immune response. As you, a plantar wart, as you walk on it and compact it, it can become more painful with ambulation. So the theme in the common prescriptions, or the theme for treatments of the warts, is definitely controlling the underlying hyperhidrosis, so the moisture balance in the feet, which we can do with having patients wear cool max socks or moisture wicking socks, help to keep the feet drier, encouraging patients to wear shower shoes or flip-flops when they're going in and out of pools or into public locker room areas, just so that way they don't pick up possibly the virus when their feet are wet and prone to picking that up. The common theme, many patients have come in and have tried a variety of treatments that are available over the counter. They'll have freezing treatments, they'll have acid, wart remover treatments, but what these serve to do, the freezing tends to cause a blister, and the hope is that you will allow the body to blister off the entire lesion, and that would help it to go away. I find that commonly on the plantar aspect of the foot, there's so much compaction of the tissue that the freezing is not as effective in getting the blister being effective in removing the entire wart. There is the topical acids, which serve to irritate and to peel the area. And by irritating the area, you're hoping that the body can then mount an immune response to help your body naturally to get rid of the wart. However, the wart is very resilient, and it tends to have its own capillary loops, so it can regenerate very quickly. So the theme in a lot of the prescription acids is something called 5-fluorouracil, which impairs healing. So we can kill it off faster than it can regenerate. There's liquid acid forms. Some companies can do compounding of the 5-fluorouracil with some acid. There are cream forms, Aldera, which patients can place onto their feet. Again, these need to be used with some pumicing of the wart too, so that we are applying the medications to kind of a live wart tissue. And if all of this continues to fail, there is laser ablation of the verruca, where you can be taken to a hospital or surgery center setting, and the wart is ablated with a laser. The laser vaporizes the tissue, so it does cause an extensive amount of damage. So patients are left with a large crater that has been vaporized by the laser that then needs to fill in by secondary intention. And so there is quite some downtime with that, with not being able to get into a shoe, really depending upon the location of where the laser was ablated, or where the wart was ablated with the laser, until that area is healed up and filled in enough to allow them to comfortably resume wearing supportive shoe gear. Even with the laser, sometimes the wart can still reoccur, but many times it's easier to treat earlier on with the acid if there's some spots that have still reoccurred. But again, long-standing control of the moisture balance of the feet and controlling the hyperhidrosis, and then just some personal hygiene changes with wearing your own shower shoes or flip-flops when you're in pools or public showers.